Welcome to the Louisiana LaHimss podcast. LaHimss is the Healthcare Information and Management Systems Society, a global health information organization dedicated to improving healthcare quality, education, and connecting people. I'm your host, Sydney Bennett, a healthcare account lead with Tech Systems and president-elect of Louisiana LaHimss. Each month, we will chat with industry leaders who are transforming healthcare through technology and bring you insights into the latest news and trends. You can find more of our podcasts by searching LaHimss, that's LaHimss, on Spotify, Apple Podcast, Google Podcast, or wherever else you listen to your podcasts. You can also find us at Louisiana LaHimss on YouTube. And finally, be sure to stay connected with us at louisiana.himss, that's HIMSS.org, and on social media for the latest updates on events, news, and more. You can find us by searching Louisiana LaHimss on LinkedIn and LaHimss on Twitter. Welcome, everyone, to Louisiana LaHimss podcast. We are here today talking with Bennett Shermy, who is the VP and CIO at Baton Rouge General. Welcome, Bennett.
Hey, Sydney. Thanks for having me.
Absolutely. I'm very interested to chat with you.
Siri just answered.
Very interested to chat with you today, given just your background in IT, as well as you are also a clinician. So just interested to hear your perspective on the healthcare industry and some things that Baton Rouge General is doing. So you were a nurse prior to your life today at Baton Rouge General. I'm curious, what made you want to go into nursing school and become a nurse?
Wow. So number one, I'm still a nurse. I still have a license here in the state of Louisiana. I always tell orientation classes, hey, look, so I'm a nurse, so if you see me walking around the hospital and you need help pulling up a patient, I'm your guy, but maybe not starting an IV. That might be something we'd need to discuss.
A little rusty.
Right, yeah, a little rusty. It's been a minute. So I originally got into nursing. Really, nursing is kind of a calling, right, to help people. And then I got into healthcare, and I'm like, wow, this is a pretty complex system. And so I did a lot of things in nursing. I quickly moved into sort of the management pieces. And this is like, I don't want to date myself, but this was pre-EMR kind of time. And we were just moving into some of those pieces. And I had a technology background. And in college, I was half computer science, half nursing. And the nursing half won. And then I think in the second part of my life, the IT half won. So went on to do some management, and then moved into pure technologies in the early 2000s, and we started putting in EMRs back then, and it just kind of took off from there. I kind of have a leg up on some of the guys because I understand the clinical jargon that seems to wrap around IT in the healthcare vertical. Absolutely,
very important for sure. So if you weren't in healthcare as a CIO or a nurse, what do you think you'd be doing today?
I still think I'd be somewhere in healthcare. Probably the nursing stuff. I really enjoyed a lot of my times in the emergency department and doing those things. In my hometown, Galliana, Louisiana, shout out to Our Lady of the Sea down there, who has a wall of nothing but fish hooks. And when we proudly took one out of somebody's foot, we always hung it on the wall as like as something that we did. I enjoyed those times, and so I think I'd probably still be doing that. I'll be honest with you.
That's awesome. Good story. I love that. Hopefully Hopefully none of those were pulled out of your foot.
No, I didn't. Fingers maybe, but not feet.
So you've been at Baton Rouge General for, as long as I've known you, a very long time.
Right around 16 years now.
16 years, wow. What keeps you there?
I think the culture and the people here. I've been through several different teams. I came here in 2008. We were outsourced at the time. Great bunch of folks, and that sort of turned over. And as my career grew with General Health, the people that I've worked with have really grown with me. Our team, our management team, our executive team, has a lot of longevity in the space. I think our CNO's been here 30 years. You know what I mean? Our CMO, who's probably one of the younger members of our executive team, has been with the General 10 years. Mm-hmm. So we have a lot of longevity. I can't think of anyone on our executive team that has anything less than 5 or 6 years here at the General.
It's not very often that you have a situation like that, for sure.
Yeah, it's quite weird. I got to tell you, it's a challenge here, but I think we pull together, and I think the people sort of keep you here. We have a lot of longevity in this organization.
So tell us more about Baton Rouge General. I mean, there could be people listening today that don't really know anything about Baton Rouge General. Just tell us a little bit more about the organization, if you don't mind.
Sure, yeah. So Baton Rouge General was founded a little over 100 years ago. We're a community hospital here. We have 3 hospitals and 30-some-odd clinics and a couple of other different business lines. But our primary hospital is our flagship hospital. It sort of shifted a little bit as the medical corridor sort of shifted. But our flagship hospital at the Mid-City campus is off of Florida, and that was really our first campus where we started to provide health care for the community of Baton Rouge. We moved to Bluebonnet as the migration from Baton Rouge came eastward to East Baton Rouge. And then we opened up recently what we're terming a micro hospital in Ascension Parish. And so we have 3 bricks and mortar joints when you talk about, like, according to Hoyle hospitals, and a number of clinics.
Nice. So you guys are 8 months-ish post go live with Epic. Y'all implemented Epic on the outpatient side, outpatient scheduling.
8 months, 7 days, and 24 minutes, but who's counting, right?
Who's counting? My goodness.
I'm just kidding.
I'm like 24 minutes. Okay. Y'all went live in the middle of the day. But anything that you would go back and do differently now that you're on this side of it?
Well, I mean, there's hindsight's 20/20, right? There's always things you can do better. But I think more importantly, some of the great things that I saw from the good folks here and General Health. I mean, we literally transformed all of our clinics in a 12-hour period with boots on the ground. Our clinicians were probably leading the charge, which is great to sort of see. I couldn't be prouder of the IT team. They got through all the difficult things that people were talking about. The TDRs are going to kill you and all this kind of jazz. And we moved through those pieces really with flying colors. One thing I want to accentuate is that we had one of the first command centers with Epic where it was callless. So there were no phones ringing. It was truly off of text and chat. Collaboration in the command center. So it was my first command center that when you walk in, there's not a bunch of phones ringing, and people answering them and all this big commotion, but rather people with, typing feverishly on keyboards and having the monitoring up and all the other pieces. So I'm pretty proud of that. If I had to look back and say what maybe we could improve, there were a few pieces. I think a little more detail into how Epic implements things, and I'm sure the first time implementers of Epic can sort of agree it's a little bit different. It's not agile. You know what I mean? It's their own flavor of implementation, and it works. But I think a lot of these work groups are working very hard. I think keeping an eye on and making sure that we're all pulling in the same direction to prevent that rework that we may be experiencing now. And maybe that's just because I'm in the thick of it right now of some of the rework. Mm-hmm. But I think some of the work group structure stuff would have been important to maybe kind of look at. I'm going to throw you a bone because I think Sydney and I have talked about this a couple times. The blend of having people who have implemented Epic before and the folks that understand the internal workings of those clinics. I was of the opinion that having more of the internal working folks was probably where you needed to be. And I sort of think that maybe bringing in a little bit more of the folks that understood how Epic implements would have benefited the overall implementation.
Yeah.
So,
I will not say I told you so.
Yeah, you said it a number of times, but I get you back every now and then.
I'm curious, the virtual or text, you called it text and chat command center, is that an Epic strategy that they're moving forward with, or was that a Baton Rouge General idea?
Baton Rouge General. Probably, I want to say 3 or 4 years ago, we went on a journey to migrate our IT help desk to round-the-clock coverage, but really pushing forward text and chat collaboration rather than phone call being the first the first means to reset your password, or all the mundane pieces. And so our clinicians here, now our footprint is rather small. I didn't cover that earlier. We're about 600 beds and some 4,000 employees. And so our footprint is small when you consider large IDNs, either in Baton Rouge or in the Southeast. But we're able to move everyone to text or chat first. And you can still make a phone call to contact our call center, but it's a lot easier to send a chat through, giving a plug to Microsoft Teams, because that's who we use. But it's a lot easier to use some of those pieces to get responses directly from the person that's going to be helping you. And I think we used that same methodology and rolled it into the command center, and we were quite successful with it.
That's awesome. That's the first I've heard of that, for sure. So just kind of flipping pages a little bit, I want to chat with you a little bit about AI. Can you tell us a little bit about how Baton Rouge General is leveraging AI today, or maybe how you want to leverage it in the future?
Yeah, I mean, I'm sure everyone listening to this podcast realizes that AI is like the new buzzword.
Of course.
I talked to a few folks around here, and it's always funny because when you ask it, what do you think AI is? Like, it'll do it all. Just put, you know what, you want to recreate the payment model for General. Just put in AI. It'll do everything for you. AI is the answer. Wait, you're having registration problems? Put in AI. And so we always gauge. I was talking to a CIO from the New Orleans area. We always gauge. The CEOs start going to convention like in the midsummer. When they come back, what they're talking about is kind of like, what you really need to know a lot about. And AI seems to be that one this year. Every CEO wants to know more about AI. It's the hot topic hitting the healthcare vertical. So with that being said, I'm still a believer that you need to crawl, walk, run when you get into these things for a few different reasons. I mean, with AI, you can move really, 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 really fast. The technology, obviously, we all know is endless, and how it learns and what it sort of does, and throwing it at problems. Everything from coding on the dev side to very, very simple pieces around communication, right? Using bots to do all those things. But it can be very dangerous too if you move too quickly and you find yourself in a position to where you're using generative AI to sort of make decisions where you need a little more oversight. Mm-hmm. So I think from a general health perspective, we're using a maturity model to sort of govern our AI practices. And I think to date, we've dabbled in it. We've identified some target sort of areas that we believe AI is more applicable, and we can move faster rather than slower. And in some areas where we want to consider, let's take a pause because this thing needs more governance around it than not. Like, for example, we provided our team here with Copilot, through Microsoft, so they can leverage Copilot in a safe environment without going out to ChatGPT and asking it all kind of questions about patients and all this kind of jazz. So we really promote that for individual or virtual assistant kind of AI. One area that I think we move quicker, would be in radiology. We have a couple software vendors that have really tied AI into their products, and it's being used successfully today by our radiology group, both on like priority setting and then even reading some of the simpler things. So we're looking to advance in those areas, and then some of the areas where we're really, I don't want to say patient or pensive, but we're taking our time, are more on the ambient fronts or the clinical decision-making pieces. We tried to implement AI very, very early on, some 5-6 years ago, with sepsis, and it was successful. We identified sepsis quickly, but what we realized was all we were doing was drawing lactates on every patient that came into our emergency department. So we really weren't doing better at it. We might have been over treating rather than treating right in the right vein. So we took a step back and we improved those pieces. But I think on the go forward, we realized a couple things. Number one, sort of where Baton Rouge General sits, right? We're a community hospital, community caring, and that personal touch can never be taken away. So we want to protect that. We want to make sure that that cold AI feeling is not not something that someone gets. We want to focus mainly on using it to allow our clinicians to spend more time at the bedside with the patients, providing that care, which is really the human touch. And so, with that in mind, those are the places where we started slowing down. So I don't want to put a doctor, in a place where he's dealing with AI rather than dealing with the patient, or having AI treat the patient rather than his eyes on it. We are looking at these technologies. We're not dismissing them, but we want to implement them smartly, because it seems that AI wants to move fast, and so it wants us to move faster, and we're kind of pulling back the reins on some of those pieces around clinical decision support and ambient technologies. Not necessarily like we're not looking at them, but sort of doing it very, very thoughtfully. We're speeding up, like I said, on bots and some of those communication pieces, and trying to meet the patient where they want to be met. So like some things when you're jumping through hoops on bill pay or any of that, we're trying to streamline on the backside with coding and those things. We're using a couple different AI pieces to sort of improve turnaround times of rooms, so that the bot helps tap people in the shoulder when a room's not cleaned fast enough. And so some of those things we're pretty aggressive with, while moving slower along the maturity model with others. Hope that answered your question.
It did, yes. Very detailed, thank you. How do you prevent, you mentioned Chat GPT, I think earlier, how do you prevent the shadow AI that happens?
Well,
that was a big sigh there, Bennett.
Yeah, preventing is tough. We lean heavily on education, and trying to teach through there. We do, in the hospital, block certain websites, or we limit the kind of traffic, or we monitor things. So we have those pieces, and we don't want to overuse that power. But at the same time, we try to educate our staff. I think the last round of education we had were people downloading virtual assistants that would go to their meetings for them on virtual platforms and take notes and then report back. And so limiting those kind of things, it's been a challenge, because obviously the world's moving faster than maybe we are in healthcare.
So outside of AI, are there other areas that you have your eye on with IT transformation, IT modernization?
Yeah, so I think we're always looking to the next. I think for us, some of the main focuses are going to be easing the communication gap or the patient experience. Every time we turn around, we find that our patients have a tough time not moving to the organization necessarily, but moving through healthcare. Healthcare is not easy. Sometimes you get 45 notifications that you're supposed to get blood drawn, and you get no notifications that you're supposed to be NPO the night before surgery. You see what I'm saying? So right sizing a lot of those pieces. One thing we put in place not too long ago, we had a sort of a communication board about surgery, and it wasn't very friendly. It was just a board. So we took that, we did the old BASF model to it, and we made it a lot easier to use. And so now that's one of the things that our patients and their family members, quite frankly, can use easily and get communications which are thoughtful, rather than having to hang around in the surgery area. There's a lot of things we're doing with that sort of piece. So I think that for us, easing that or improving the patient experience, whether it be through scheduling, bill pay, routing through the hospital, just the simple things, navigating care. It could be the way a text message is delivered to a patient. I don't know if any of you get these things, but every time I get a text message from 9654632, right, I'm like, oh, is this really Baton Rouge General trying to tell me in their little robotic voice that I have an appointment tomorrow? Or is it somebody else doing something else to me? So I think we're trying to bridge that gap to make those things more thoughtful and meaningful. It sort of fits in with the whole, we want the patient to be first, and we want to connect our clinicians to the patient rather than just providing information. So I think that piece, that patient experience, leveraging technology to achieve it, is really going to be a big focus for us in the upcoming year.
Well, I can certainly appreciate that, and just my experiences as a patient for sure. So, what?
Yeah,
Go ahead.
Yeah, I mean, the other thing that I think we can all share is that we've been trying to axe the facts. That's our term for it, axe the facts, or get rid of faxing. Every time we turn around and somebody wants a fax machine or somebody's faxing stuff to us, and we're trying to get rid of faxes. If anybody out there has an idea on getting rid of all faxes, please let me know, because I think healthcare is going to be the last vertical supporting that technology.
So with the text and chat, how do you support that with patients that are maybe not as technology savvy?
That's a great point. So, we realize that the population is sort of flipping from not savvy to savvy, right? And so we're not dismantling some of those other mechanisms. So like phone, personal navigation. But what we are trying to do is, most everyone that's not tech savvy has a loved one. I say most, right? I'm talking about most. A loved one or a caregiver that helps them navigate healthcare. And we want to make it very, very easy to tie that person into that patient's experience. So, it may be texting both or collaborating with them both. Even one more primary than the other. Identifying those people up front and explaining to both how we want to communicate. I think it's something that we're focusing on.
Awesome. So what can we expect to see in the future marketplace from Baton Rouge General?
Oh, wow. So that's a sort of a loaded question. I think General Health
Spill the secrets.
Right,
I want
exactly.
to know.
I think providing quality care for the community of Baton Rouge, we feel we have a moral obligation to provide the best care we can, and to every patient in Baton Rouge. I do think that we want to provide care where care is needed. We realize that North Baton Rouge might be a population that needs to be better served. So we're trying to move service in those areas. As a matter of fact, we just, as of last week, purchased a mobile care unit that we're sending to places to provide mobile clinic care. So we have a doctor on board to do screenings and to see patients connected to EMR and do all of the pieces just like you would an office visit, just do it in a mobile fashion. So we're reaching out to businesses. Any gatherings, we'll go and provide that care or screenings. And so that's a way we're doing outreach for the community of Baton Rouge. I think other ways we're going to leverage technology here at Baton Rouge General, right, is to keep on the connected piece. I think that there's still a lot of work to be done around connecting all of our facilities, all the caregivers in Baton Rouge, and being able to share information on that interoperability front. So I think we're going to keep pushing very hard to be interoperable with our partners, which we're all pushing in the same direction for that.
So I'm curious, what's it like to be a community-based hospital right now? Because there's this very big push and pull between you're trying to care for your patients, you're trying to make investments in these rural areas where maybe it's a risk because the payer mix is not as ideal in those areas, but it's the right thing to do. The whole kind of concept of, is healthcare a right or a privilege?
I thought this was an IT thing, Sydney. We're going off the rails here, but I think from a community hospital perspective, so number one, I think we all agree that rural hospitals are not only large IDNs, but that middle tier care is necessary when we're talking about meeting patients where they are. And so I think I want to stick on that theme because we're partnered with 30 some odd rural hospitals throughout the state of Louisiana. We're part of the Louisiana Independent Health Network Coalition, where these independent rural hospitals, we all get together because we have the same sort of issues, right? I mean, more to what you were referring to, and what do you do here? How do you afford to do that? How do you build that out when you might not have these things, right? And I think that link group has really come together, and shared experience helps us move forward in a lot of these initiatives where, how do you perform social determinants of health if you're a rural shop? It's cumbersome, right? How do you join an ACO, or how do you do these things? How do you even have the technology to get there? So I think some of that stuff we worked well together find means to sort of do it. We're working with a couple hospitals on telehealth and providing specialty care, leveraging telehealth in different areas, and that's proved fruitful for those places that just, you're not going to get a cardiologist to get out there, right? Mm-hmm. And so I think some of those things, once we all agree that rural health is important, and it is, then we can sort of see and develop strategy on doing that, and Link is a prime conduit for getting there.
Yep. I love to see that collaboration and partnership and communication with others, because it is so important to rely on one another to figure out how everybody else is doing things and how you can improve as well. So
yeah, it's a challenge.
So I've asked this on a previous podcast that I did, but and the healthcare kind of ecosystem, we've got payers, providers, pharmaceutical companies, the patient. We have all these different players in the ecosystem that is healthcare. If you could change anything about that healthcare ecosystem and how it all kind of interrelates and works together, what would you change? How would you make things better?
Wow. Well, that's sort of a loaded question. So, like, if I had a crystal ball or perfect world kind of stuff, I mean, for me, I think, and I don't want to say payers here, but what I want to say is, right now, for a patient to receive care, understand what they're paying for care, buy that service, and then pay for it and get, you know what I mean, and pay for it and just buy that service. If you go to the store, you buy a gallon of milk, you know what you're getting, or you go and you buy a television, you know what you're getting. You come into healthcare and it's like, okay, I guess I'm going to be billed by 4 or 5 different people. I'm not exactly sure, but I know I need this item. All of the pieces between the patient, the provider, and the payer on that thing where you're passing through clearinghouses and medical necessity checks and all of these different, I don't want to say stops, but this is all sort of different places that are now taking part in through the revenue or payment cycle for healthcare, and that process has really gotten convoluted. I don't know, Sydney, have you been in health? Have you ever had like a medical procedure of sorts, not digging too much, where you absolutely clearly knew what was going down when you signed up to do the thing?
Going down, what do you mean? From like
what you're going to pay for, right? Like you walk in and
no, never.
Like I know you have some children. So you go to have your child's like, okay, I'm going to, right? I mean, no, it's the fear of the unknown. And I think getting to a place where I mean, price transparency is, I guess, heading in the right direction. It's a good first step or good necessary step. But those pieces are payer disparity across the board. All of those things, understanding that, I think is a place we can start in healthcare. I think that's been sorely convoluted over time.
Yeah, I definitely agree with you there. I mean, I took my son to the emergency room to get 3 stitches and had 3 different bills from 3 different parties. Yeah. So it's definitely confusing, and you don't really understand it as a patient, and there's not a lot of I guess information on the front end on what the expectations are going to be for that. Right. So it makes a lot of sense.
Yep. It'll be interesting to see how AI deals with some of those pieces, but that's for a conversation at a later date.
Well, thank you so much for your time today. I really enjoyed chatting with you, and looking forward to hearing more about Baton Rouge General and the things that you guys have coming up in the future.
You got it, Sid. Thanks.
All right. See you later.
Bye.
Welcome to the Louisiana LaHimss podcast. LaHimss is the Healthcare Information and Management Systems Society, a global health information organization dedicated to improving healthcare quality, education, and connecting people. I'm your host, Sydney Bennett, a healthcare account lead with Tech Systems and president-elect of Louisiana LaHimss. Each month, we will chat with industry leaders who are transforming healthcare through technology and bring you insights into the latest news and trends. You can find more of our podcasts by searching LaHimss, that's LaHimss, on Spotify, Apple Podcast, Google Podcast, or wherever else you listen to your podcasts. You can also find us at Louisiana LaHimss on YouTube. And finally, be sure to stay connected with us at louisiana.hims, that's HIMSS.org, and on social media for the latest updates on events, news, and more. You can find us by searching Louisiana Hymns on LinkedIn and LaHimss on Twitter.